again, just want to make clear that senior citizens, people with disabilities, children with disabilities, those who are pregnant women and those who live beneath the poverty line, they are 100% protected. They do not have to fulfill any work requirements. What we do is people who are ineligible and defrauding the system, they are going to be dealt with, and also people who are in the country illegally, they will no longer be able to benefit. New York, unfortunately, is one of the states where the state has provided a kind of loophole backdoor way for illegal immigrants to benefit from Medicaid dollars. We put an end to that. And then the work requirements, which 90% of Medicaid recipients already work, those are for able-bodied individuals who are of working age, mentally capable to do so, and it's a part-time requirement, which is vastly supported by Americans all across the country.
Good evening, everyone, and welcome to today's telephone town hall with Congresswoman Nicole Malliotakis to discuss recent legislation passed by Congress. My name is Taylor, and I will be moderating the event this evening. This is an interactive forum, and Congresswoman Malliotakis wants to hear from you, and we'll be taking as many questions as possible. If you have any questions, please press *3 right now. Again, please press *3 on your telephone keypad or at any time during the event to ask a question. Also, if you would like to sign up for Congresswoman Malliotakis' weekly newsletter, please press 1 at any time during the call. I am pleased to now turn this over to Congresswoman Malliotakis.
Good evening, everyone. Thank you very much for joining my TeleTown hall. I'm in Washington right now, but we are very excited to just give you an update on what I've been working on. I know that there's been a lot of questions surrounding the One Big Beautiful Law that was passed and signed into law by President Trump on July 4th. I wanted to go over some of those provisions and then answer questions either about the legislation or about any work that's happening in Washington or in New York City. So we'll try to make it as interactive. I'll try to keep my answers as short as possible so we can get through some of these provisions and questions. Well, first, I just want to give a basic overview. The legislation that we recently passed actually provides the largest tax cut in history for working Americans, middle-class families, and our senior citizens. Most importantly, probably for New York, is that we were able to get back a good chunk of the SALT deduction, the state and local tax deduction, which is now going to be quadrupled to $40,000. Now, this means if you're a family earning less than $500,000, which 98% of our district will be covered by this, you'll be able to deduct your local and state taxes, including your property taxes, so you don't have to pay twice, meaning you won't have to pay that to the federal government again on that income. So this is really important for us. It's a big win. It's something that I really fought hard for, along with the bonus deduction for our senior citizens. Seniors 65 and older, we were able to give a deduction that will cover 88% of seniors across the country. 51 million seniors will now see their tax liability on Social Security eliminated. Now, it'll be done in the form of a deduction, which means you'll get it when you file your refund, because by law we couldn't do it we couldn't change Social Security law within reconciliation bill. So what we did was give a deduction that would cover that. So that will be a big saving. So if you'll be most likely either covered by one of these provisions if you live in our district, and it could really be a significant amount of money in savings, a few $1,000s for families that we represent. But this is also on top of preserving and increasing the child tax credit and the standard deduction. Child tax credit will now be $2,200 per child. And there's other important provisions in there as well. Obviously, you've heard a lot about the service workers, such as waiters, bartenders, people, hairdressers, for example, Uber drivers, that they will see a big reduction in the taxes that they pay on tips. Overtime workers will also benefit. Now, I want to talk a little bit about Medicaid, because this is also important. There's been a lot of misinformation. I think it's really important to stress that traditional Medicaid recipients, our senior citizens, our disabled, our children with developmental disabilities, people who live beneath the federal poverty line, pregnant women, they are all covered by Medicaid, and nothing changes. Nothing changes. Their eligibility stays the same, benefits stay the same. In fact, the only changes that we make here when we talk about rooting out waste, fraud, and abuse is that we ensure that if you are ineligible for the program, that you're removed. We don't change the eligibility. We just simply say that if we check to make sure you're eligible, and if you are receiving benefits when you're not supposed to, that's fraud, and we're going to stop that. And we're also going to make sure that people who are in the country illegally, that they do not benefit from these Medicaid dollars that are meant for our vulnerable citizens. One of the only changes is a work requirement, which is very reasonable. And this is for, again, none of the vulnerable populations I listed will have to do the work requirement, but people who are of working age, who are mentally capable, who are able-bodied will have to work, volunteer, or they can learn part-time, so 20 hours a week, and that's the only requirement, which, by the way, 90% of Medicaid recipients already do work. So there's been a lot of fear-mongering and misinformation about the Medicaid provision, so I just wanted to clarify that and know that I fought very hard to ensure that the federal reimbursements, the federal matching funds that New York State receives remains the same. So there's no cut in the matching funds that we receive in New York from the Medicaid program. So I wanted to also just point out real quickly before we go to the first question that this is also a huge investment that we're making in our national security and public safety. This is truly a America First piece of legislation where we are securing critical funding to upgrade our military, to secure our border, to hire law enforcement, to deport people who are in our country illegally and are criminals. We've seen what happened in New York City with individuals in our country illegally who were wreaking havoc, gang members, drug traffickers. We've read about it regularly in the press. We put an end to that. We've seen significant zero illegal border crossings, by the way, last month, and we don't read about those stories each and every day in the paper anymore about the criminal activity. And you should know that I had put in a Freedom of Information Law request, and we found from the city that it was 16,000 crimes where the perpetrators were living at one of the migrant facilities that the city had set up that we, the taxpayers, were paying for. 16,000 crimes, 7,000 of which were one of the major felonies, and it was 4,000 perps tracing back to one of those facilities. So we're glad to put an end to this once and for all, and very happy to start taking your questions. And I really appreciate you taking the time to come on. We have a few thousand people on the call listening, so thank you very much for participating.
Thank you, Congresswoman. Again, for anyone that is on the call now, please press *3 at any time during the event to be able to ask a question. And we will jump right into it with our first question. It looks like we have Conchetta from Bass Beach, who, is it true that seniors will have no tax on Social Security?
So I kind of touched on this in the beginning, but just to emphasize, let me explain what happened here. So we could not change Social Security law because you need 60 votes in the Senate, which would mean that some of the Democrats would have to work with us to pass the bill, and sadly they wouldn't do that. And so what happened here is we did what we could in the reconciliation bill, which meant that we give a deduction. So you will pay your taxes or you see your income checks as you usually do. At the end of the year, senior citizens will see a $6,000 deduction per senior. If you're married, it'll be $12,000 deduction. And that, if you are of a certain income, that will completely erase your tax liability. You will get, a refund. That is for people who the income level will be $75,000 for a single senior or $150,000 for a married couple to get that full deduction. And as the income increases, the deduction phases out. However, because of the state and local tax deduction that I secured, if you are above that income for whatever reason, you will still benefit from the SALT deduction on top of it. So you will be most likely covered and see your tax liability completely erased. And so it is significant. This is one of the biggest things that I fought for, was my legislation actually that I drafted that made it into that final package. I did many press conferences with AARP and the local senior centers to push this. So it is a big win for the seniors in our community who, quite frankly, have struggled living on Social Security or limited retirement income. Many seniors who bought their homes and now have been living there for decades are finding it more and more difficult to keep up with their property tax payments. So the two things combined, the senior deduction as well as the SALT deduction, will help our seniors tremendously. And then those who are of younger age, they will benefit from the SALT deduction. They will benefit from the child tax credit. So we should see significant savings by residents. Of course, it would be helpful if our mayor and our governor, state legislature, did what we did on the federal level, which is actually lower income tax rates, personal income tax rates, and cap property taxes. They can cap the property tax levy, but they choose to increase it year after year, which is why we needed this SALT relief to begin with.
Great. Thank you, Congresswoman. We'll move on to our next question. Ryan from Staten Island. I heard something on the news about a tax credit for an American-made car.
Yeah, so we try to put in some provisions in there to help make in America again, right? We want to make in USA. And one of the things is if a vehicle is made here in the United States, if you purchase that vehicle, you can deduct the interest on your loan to purchase that vehicle. So this is one way we're encouraging auto manufacturing to be repatriated here in the United States. There's some other things that are really important in there. One of the things that I've been advocating for is to bring our pharmaceutical supply chain home. We rely on, believe it or not, communist China. 80% of our drugs come from overseas, and the majority of that is from communist China. And so it's very dangerous, number one, and we have to get that to either countries that like us, or we have to do it here in the United States. And so some of the provisions in this law will actually incentivize manufacturing facilities to be built or expanded here in the United States, but that does take some time. So in addition to that, I've introduced legislation to allow for the president to enter into preferred trade agreements with countries that are friendlier, so we can work on that supply chain issue now as we get those facilities built. But if you've seen in the news, there's already been a number of automakers, pharmaceutical companies, semiconductor companies that are making trillions in private investment, and we're seeing that little by little coming to the United States, and this legislation will actually help secure more of that, so we are self-sufficient.
Great. Thank you, Congresswoman. As a reminder, if you'd like to ask a question, please press *3 at any time during the event. Also, if you would like to be subscribed to the Congresswoman's monthly newsletter for constituents, press 1 at any time during the call. And we will move on to the next question. Frankie from New Dorp, the state and local tax deduction changed a couple of times. What is it now, and is it for this year?
Well, I already addressed that, so I think we can kind of skip that. Basically, just to answer, it will apply to this year, 2025. So when you file your taxes in 2026, you can then take the senior deduction, the child tax credit, the standard deduction, or the SALT deduction, applying it for this year. So that you'll get immediate savings when you file your taxes the next time.
Okay, thank you, Congresswoman. We're going to move on to Mitch from Bay Ridge. What are you doing to secure the border? What has already been done?
All right, this is an important question because, as I mentioned earlier, we saw a lot of criminal activity, 16,000 crimes, where the perpetrators traced back to migrant shelters that were placed in our city by the mayor. And what we've seen already done is that the border has been secured to the point where there are 0 crossings last month. Remember, Joe Biden said we needed a law to be changed in order to secure the border. That was utter nonsense. I said it at the time. This president came in, immediately secured the border. What we're seeing right now is 0 border crossings last month, and we're also seeing that these gangs have been broken up. They're being deported. We also saw the cartels were designated as terrorist groups. We've also increased significantly investment in our law enforcement, in border security measures. In this bill, we make other investments. We hire more law enforcement. We put funding in place for more barriers. So all of that's being done. Now, I do want to say that my office has been very helpful in helping people who have followed the rules and have done everything right and have been waiting a long time to become American citizens get to that point. And so we're very proud of our record of helping hundreds of people who have been caught in the red tape and the bureaucracy become citizens. And we should reward those individuals who have been law-abiding and did everything right and have just got caught in unnecessary delay. So we want to differentiate, of course, between people who in our country illegally who are committing crimes and those who have followed the rules and have done everything right. And we'll continue to help individuals who are in the process right now waiting for their citizenship become United States citizens.
Thank you, Congresswoman. This person didn't provide their name, but said, can you explain the tax changes to Medicaid? Who gets kicked off of this? I know that this was asked previously, but for those who weren't on the phone already, could you just quickly provide information on that?
Again, just want to make clear that senior citizens, people with disabilities, children with disabilities, those who are pregnant women and those who live beneath the poverty line, they are 100% protected. They do not have to fulfill any work requirements. What we do is people who are ineligible and defrauding the system, they're going to be dealt with, and also people who are in the country illegally, they will no longer be able to benefit. New York, unfortunately, is one of the states where the state has provided a kind of loophole backdoor way for illegal immigrants to benefit from Medicaid dollars. We put an end to that. And then the work requirements, which 90% of Medicaid recipients already work, those are for able-bodied individuals who are of working age, mentally capable to do so, and it's a part-time requirement, which is vastly supported by Americans all across the country.
Okay, thank you, Congresswoman. Again, for anyone that is on the line and would like to ask a question, please press *3. We will move on to the next question. Jennifer from Bath Beach as well. Is there any tax credits for college-age children?
So there's a few education components to this. One of them was my legislation, actually, that would allow for a certain amount of employer reimbursement for student loans. If you're in one of these tuition or loan reimbursement programs when you come out of college, there is a portion of that is going to be tax-free income, and so that's going to help our recent graduates. We also have school choice tax credit in there. So scholarships, people who donate to scholarships, they can receive a tax credit, which will incentivize people to donate to scholarships for private schools, parochial schools. That is a real big component that we've tried many years in New York State to provide that type of incentive because we saw a lot of our parochial schools closing. in the district, and unfortunately the state never did it, but we were able to do it this year, and that's going to be helpful as well in providing school choice for America's families.
Very good. Thank you, Congresswoman. Again, if you'd like to be subscribed to the Congresswoman's monthly newsletter, please press 1 at any time during the call. And we are going to move on to our next question here. This is from Maria. Maria asked, is there any restoration taking place at Gateway in Staten Island?
Yeah, I'm glad you brought up the Gateway, because this is a park that I actually frequent and use a lot. And there's been some erosion issues. Those people who use Gateway National Park on Staten Island, they see the erosion that has taken place. We had a recent meeting there with Army Corps of Engineers, as well as the National Parks Department, and we're working to address that. They put, as those who go to the park will see, that they made some short-term fixes to just make the area safe. They've moved the walking path in a little bit. Unfortunately, that took away a lane of parking. But it was just an erosion that we had to address it in that way, and now they're going to try to come up with a more long-term plan. I just met with the new administration's Interior Department, which is the one that oversees all of our national parks, and we spoke both about that and Floyd Bennett Field. As you know, Floyd Bennett Field was used for a migrant encampment. There was a lot of opposition of that in Brooklyn. That was immediately shut down upon this new administration coming in, which was good news for the Brooklyn community that used that park. We also were able to get the Aviator facility in Brooklyn, an operator to take to extend its facility there. That was very important for families and children that used it for hockey and other activities. So we were able to save that, working with the National Park Service. And on Staten Island, we're dealing with this erosion issue and some more. I've urged them to really take a look at making improvements to Gateway National Park because it's been a long time that they have not had any improvements, and we need to see that type of investment made in our park. The seawall project on Staten Island is under construction. Phase 1 started, and they are doing some of the drainage work necessary as part of that phase 1. And so we're working diligently on that. We're working on an agreement between National Park Service and the city for the remediation in Great Kills Park, which is necessary to get that wall completed. So there's a lot of ongoing things that you may or may not see. The drainage portion of the seawall is actually happening like kind of behind a wooded area, so you may not see it as you're driving down, but the project is happening and it is underway, and we're proud to have gotten that back on track.
Thank you, Congresswoman. We have Joseph from Staten Island who asked what you are doing for congestion pricing.
Yeah, Joseph, thank you for the question. So this was one of my biggest things. As you know, I've been very vocal against congestion pricing. I look at it as just a cash grab. We already pay a toll to connect to the rest of the city. We shouldn't have to pay another toll. And we were successful in getting President Trump and his administration to rescind the Biden approval of congestion pricing. The problem that we have is that the governor is not complying. She's chosen to allow these cameras to operate anyway. And so we are now in court, and we're battling this in court. And so this may take a while. Some of these cases take a long time. As you remember, or may not know, I had to go to court with my colleagues, the borough president, as well as others, local elected officials, to sue and stop non-citizens from voting in our election. This was a city law that was passed. And it took us 4 years. We just a few months ago won the final round in court. We had to go to the state Supreme Court, then the appellate division, finally the Court of Appeals. And we never allowed non-citizen voting to take place because of our lawsuit, and we finally won just a couple of months ago which is great news, but it took us 4 years. So sadly, this fight with congestion pricing could take a long time, but I do appreciate President Trump and Secretary Duffy immediately rescinding the approval that President Biden put in place to allow congestion pricing. I believe they're operating these cameras illegally, not only because now they rescinded the authorization, which makes it illegal, but even when they had the authorization, it was illegal because they never completed what was called an environmental impact statement as required by federal law, and that was the basis for another lawsuit that I and others had against the state of New York and the MTA. So we're letting these cases play out in court, and we're really hopeful that we'll prevail at the end of the day.
Great. Thank you, Congresswoman. We'll move on to the next question. We have Peter from Westerly asking about what's being done with the helicopters that continuously fly over Staten Island.
Yes, we're having many meetings with Secretary Duffy, with the helicopter operators, trying to get to a resolution. What happened was the FAA never changed the flight path. It was that a helicopter heliport in New Jersey closed, and so traffic was now then rerouted from another one. Some of the complication was due to air traffic control issues at Newark Airport. So we're addressing those issues while also working with the FAA to put in place better regulations, safety standards. We're hoping that they'll ban certain type of helicopter travel above residential areas like ours. So this is a work in progress, and we're pushing them to try to get this resolved as quickly as possible. The air traffic control issue at Newark Airport. This is important, and they've already made significant steps. Number one, they completed the renovation of a recent runway, which was really important. It created a lot of the delays that we saw. And they also improved one of the new fiber optic cable networks. They just did it this month. So that is great news. Now, in the bill that we passed last couple weeks ago, we had more investment in the FAA communication system that will not just benefit Newark, but modernized air traffic control system throughout the country. This is something that is long overdue, and I'm happy that this administration is prioritizing that. And so that'll be good news for air safety and travel.
All right, and just a couple quick reminders again. If you would like to ask a question, please press *3. And if you would like to sign up for the Congresswoman's monthly newsletter, please press 1 at any time during the call. We are going to move on to our next question. All right, we have Maria, and Maria is from Staten Island. What will the Congresswoman do about the cuts to food stamps and serving the underprivileged?
Okay, well, thank you, Maria, for giving me the opportunity to address this issue. Obviously, it's a very important one. And on SNAP, which is also known as food stamps, we actually put in place a cost-sharing structure to encourage states to reduce fraudulent payments. Well, let me explain. In New York, there have been fraudulent payments in the program that have doubled over the last 5 years. They very much surpass the national average in incorrect payments. And so what we simply do is ask the state to, within the next couple of years, we give them some time, it's not immediate, we ask them to rectify that rate to make sure that they're making less improper payments to preserve the program. And if they don't do that, then we simply ask them to pick up a small share of the cost. Because right now the federal government picks up the entire cost of SNAP. But we really need the state to do its job here and to crack down on those improper payments that they're making. Because again, it has doubled over the last 5 years. It is well above the national average. And, we have to make sure that we're preserving taxpayer money and ensuring that it's going to the people who truly need these programs. And I should also point out, with regards to Medicaid fraud, our governor, our state controller, our state attorney general have all talked about how riddled the Medicaid program is with fraud. In fact, just about a week ago, our attorney general pressed charges against transportation companies that were bilking the Medicaid program. If you Google Medicaid fraud in New York, you will see all sorts of examples of the fraud in this program. And number one, that's stealing from the taxpayer. Number two, that's reducing the money that's going to the actual vulnerable people the program was intended for. And so I also had a question here that I saw somebody asked about, verification. We're going to work with Dr. Oz and our federal secretaries that are in charge to ensure that the eligibility, to check eligibility, which we're going to be doing more frequently, is done in a manner that is easy for people. I've stressed that to them, that we need to make this easy for people to be able to, or for the state rather, to check eligibility of individuals. And so we want to make sure that everyone understands that. And also for the developmental disabilities community, again, 100% protected. They're in that group that I mentioned earlier of traditional Medicaid recipients. You should know that they do not have to adhere to the work requirements. They're completely exempt. So I want to stress that, because there was a protest in front of my office, and there were a group that were concerned about the developmentally disabled. I am too. That was actually one of the things that I made very clear from the very beginning, that we had to make sure our disabled community was 100% protected, as are our seniors, and that was completely taken off the table in terms of doing anything to make it harder for them or to implement work requirements on them.
Okay, thank you, Congresswoman. We have another individual here. They didn't give a name, but they asked, is it true that there's going to be a ferry between Staten Island and Brooklyn? Will it actually happen?
Yeah, so this is actually the closest we've ever been to getting that Staten Island-Brooklyn connection. And we're excited about it. We think that what happened this week was the New York City EDC came out and said they came out with new proposed routes, and one of them was a connection from Staten Island to Brooklyn, which is great. And right now they're going to go through a public comment period, and we will put that information on our Facebook page so people can find the link if they want to comment in support of this, and that will allow us to get the traction necessary. And if all goes well, which it seems it's on the path to be done, this can happen as soon as this winter. So we're very excited about this. I've, as a member of Congress, helped deliver millions of dollars for the Staten Island ferry, and both for improving the boats, modernizing the boats, to improving the infrastructure. We've delivered a lot of money for maritime infrastructure, which has brought a lot of jobs to our area. We have a robust maritime industry still on the North Shore of Staten Island, and we also have in Brooklyn, in southern Brooklyn. So we're happy of the investments that we've been making in the maritime industry, in the ferry network, and we want to see us use more of our waterways to transport people, to reduce traffic and give people alternative options.
Okay, and Diane from Tottenville is asking, why is this town hall being done over the phone?
How many people do we have? Let's see. Well, first let me say that we have over 3,500 attendees on the phone right now, and we could obviously never find a facility that large where we could have so many people in our district. And this made it very easy and convenient for people to participate, where they didn't have to actually travel anywhere. Plus, I'm in Washington, which also complicates the situation. But obviously, this is a great way for me to get the message out, answer your questions. You could do it from the comfort of your home, and we can reach the most people, which we wouldn't be able to do that in person.
Okay, thank you, Congresswoman. Again, if you are on the line and you would like to sign up for the Congresswoman's monthly newsletter, please press 1, and we will move on to one more question. We have Barbara from Staten Island. What is the Trump administration doing to help the elderly and nursing homes?
Yeah, I think this is important to note that we actually exempted nursing homes from a provision that's called a provider tax. The state places a tax on healthcare facilities, and then they use that as a way to get more federal funding. In a way, it's a scheme, quite frankly. They're taxing medical facilities to then get matching funds from the federal government and then reimbursing the facilities. We made sure that the nursing homes were exempt from any crackdown on that because we had heard from the nursing home community that this could affect them. It could lead to closures. And so I just want people to know that we're doing what we can to make sure that we protect those nursing homes for our elderly. We have very limited ones in our district. We want to make sure that they remain open. And with the hospitals, I want you to know that we also, again, we made sure that the matching funds that we received from the federal government remained intact. It currently is a 50% match for traditional Medicaid, 90% match for expansion of Medicaid. And some other provisions like site neutrality and things that people may not know unless they're actually in the hospital industry, we were able to ensure that there were no changes there. So I think we did a good job of finding that proper balance.
Okay, great. Thank you, Congresswoman. We have Desiree from Staten Island. How is the Congresswoman supporting showing an ID to vote?
Yes. Well, I'm a co-sponsor of legislation that would actually require a voter ID. I think that is important. We should have voter ID. If you can show an ID to go buy a beer or to board a plane or to drive, there's no reason why you wouldn't be able to show ID to vote. I think it is important for voter election integrity that we have that, and we did take a vote on it. We're hoping to see it become law, and we'll keep pushing it. But I am a co-sponsor of that legislation.
Thank you, Congresswoman. And I think we're going to take one final question here. We have Tony from Westerly, and he's asking about his tax return that was stolen. What's being done to prevent fraud?
Okay. So first of all, I want people to know that my office is always here to help. If you have an issue with Social Security, with Medicare, with any of these programs that we mentioned, federal government, please let us know. We have helped thousands of people resolve issues. If you've had a check stolen, whether it be a tax refund or Social Security check, please call our office and let us know. If you are having trouble getting approved for your disability, for example, or you have trouble renewing your passport, these are things that we can help you with, and we're glad to do that each and every day. I'm very proud of my staff for the constituent service. My Staten Island office phone number is 718-568-2870, and in Brooklyn, the number is 718-306-1620. And we're happy to help you if you have any of those types of issues. But we have done a few things on this. We've had a hearing on it. We've introduced legislation. The president wants to move forward to making sure that checks are distributed electronically moving forward, these payments, so that way we crack down on this fraud. We've had people who have had second, third, fourth replacement checks stolen, believe it or not. And so we've worked with the DA's office, NYPD, and the various federal agencies to try to find better ways to get these payments to people. But the most important thing is we need laws where these people are actually prosecuted. Sadly, in New York, too much crime is happening where they're not being arrested or repeat offenders are back onto the street, which is why I urge our state lawmakers to fix the bail law. And the governor's, governor has not done that, and that's unfortunate because we need to have consequences. That's really how you're going to crack down on this type of criminal activity.
Great. Thank you, Congresswoman. We did have one final question. We'll go through one more. John Brownell wants to know what it was like speaking to John Voight.
Yeah, I guess he saw that on my Facebook page. So I'm working on a provision. As you know, there's a lot of economic activity involved with television and film industry in our district. We have studios both on Staten Island and Brooklyn. We've had a number of television series filmed in our district, from Gotham to Boardwalk Empire to Ray Donovan, et cetera. And I'm working with John Voight now on legislation that would help continue that. It's really important to New York. It brings a lot of economic activity and jobs. And so there's just another piece of legislation that I'm working on. But look, I really appreciate everyone taking the time to join us tonight. We'll do this again in the future because I think we'll get your feedback and see if you want me to do it again. We will do it again. But I thought it went very well. I think I was able to cover a lot of questions here. And as things move along, we'll continue to, keep you informed. But I want to thank everyone for joining the call, and we'll continue to, fight for you here in Washington. And please reach out to us, and we're happy to always assist with any constituent issues that you may have, particularly as it relates to federal agencies.
Great. Thank you all for joining us this evening. We were able to reach many of you, but if we were not able to take your questions, or if you need any assistance with a federal agency, please reach out to the Congresswoman's office. You can visit our website, malliotakis.house.gov, or call our Staten Island office at 718-568-2870. Again, Staten Island office, 718-568-2870, or our Brooklyn office, 718-306-1620. Brooklyn office, 718-306-1620. You can also sign up for the Congresswoman's monthly newsletter by pressing 1. And again, we thank you all for joining, and have a great night. Good morning, everyone, and welcome to today's telephone town hall with Congresswoman Nicole Malliotakis and Secretary of Veterans Affairs, Doug Collins. My name is Taylor, and I'll be moderating the event this morning. This is an interactive forum, and Congresswoman Malliotakis and Secretary Collins want to hear from you, and we'll be taking as many questions as possible this morning. If you have any questions, please press *3 right now. Again, press *3 on your telephone keypad or at any time during the event to ask a question. Also, if you would like to sign up for the Congresswoman's weekly newsletter, press 1 at any time during the call. Now, I am pleased to turn it over to Congresswoman Malliotakis and Secretary Collins.
Good morning, everyone. Congresswoman Malliotakis here. I want to thank you for taking a moment to join our Veterans TeleTown Hall. I thank Secretary Collins for joining us. Today is about you, our veterans, your service and your sacrifice, and how we can do a better job honoring you and providing services to you in Staten Island and in Brooklyn and across the nation. And I'd like to address your concerns and set the record straight because there has been a lot of misinformation about veteran services. First, I want to highlight that the fiscal year 2026 Veterans Affairs budget that we just advanced out of the House of Representatives will invest a record $450 billion in the Department of Veterans Affairs, an increase of 3% over last year and $84 billion more than when the Biden administration left office. Every VA health care program and every earned benefit is fully funded, and we are supporting President Trump's efforts to combat veteran homelessness by investing in the new rental assistance program for veterans and continuing funding for research, mental health programs, and other programs that our veterans rely on. There has been a lot of misinformation surrounding cuts and hiring freezes at the Department of Veterans Affairs as well, and these reports are inaccurate. Veterans Affairs medical staff have been exempted from the across-the-board government hiring freeze, and essential jobs like doctors, nurses, and claims processors have not been cut. The Trump administration and the Secretary are determined to improve the operational efficiency of the VA, as am I, and this includes phasing out non-essential roles like interior designers, DEI positions, and other non-essential administrative positions. And the savings from phasing out the non-essential jobs will be redirected to continue improving veterans' health care and benefits. At the Brooklyn VA hospital specifically, many of you know that I fought very hard against the Biden administration's proposed closure of the facility. This is a facility that provides care for so many of you, and I've tried my best to help make improvements there over the last couple of years, improvements to parking. The parking lot was recently redone, and we've also made major investments in the care. There's been a brand new radiation oncology suite that was built. There was a state-of-the-art equipment that has arrived, that will be arriving soon, and a permanent brand new MRI unit just opened this week, replacing the trailer that was previously in use. And on communications, this is a big one I know many of you have spoken to my office about. All phone lines are now operational, and the VA has assembled a task force to improve how patients navigate the phone system. And I want to thank Secretary Collins for this initiative, because some of the issues with the phones and not being able to reach someone, or that it keeps ringing, and or sometimes you even get disconnected, it's really been a big problem, and I look forward to working with the Secretary, and I'm glad that this administration is prioritizing that. I'm actively working with the Veterans Affairs Secretary and the Brooklyn VA Director, Timothy Graham, to fix ongoing issues at the facility. Issues like the elevators not operating, they're being fixed. Every time we fix some, it seems other ones break, and that's been unfortunate, but we're trying our best to keep them make them all operational by the end of this month. And there have been rumors that the ENT clinic at the Brooklyn VA will close. Again, this is a rumor that is inaccurate. We've double-checked that with the director, Timothy Graham himself. The clinic will continue operating as usual. And regarding ongoing issues with the phone services, I'm also working with Brooklyn VA Director to implement some upgrades, so veterans like yourself can easily speak with your doctor without interruption. And we're currently working on reopening the substance use disorder unit and relaunching the Care for Homeless Veterans program at the Brooklyn VA. During my time in Congress, I've always supported legislation that prioritizes and improves veteran care, including voting for the PAC Act to expand VA health care benefits for veterans exposed to burn pits and other toxic substances, including veterans from the Vietnam, Gulf War, and post-9/11 eras. Beyond the budget, we're passing bills that you've asked for: clearer VA communications, faster claims processing through the Wingman Act, expanded home adaptation grants, and hyperbaric treatment options for TBI and PTSD. Now, I want to, again, thank you all for your service. You've all stood up for our country, and I'm doing my best in Washington to now stand up for you. And today I'm here to listen. Tell me what you think is working, what's not working, and how my team and the Veterans Affairs Secretary can help. And I want to thank and now introduce our Veterans Affairs Secretary, Doug Collins.
Well, good morning, everyone, and Congresswoman, thank you for laying a lot of that out. It's good to be with you, and also always good to be with friends up in New York in the areas that you have represented so well, and I appreciate that opportunity. And I thank you that you started off the way you did, and that is taking, what I've been doing now for almost 6 months, and that is taking on the unfortunate rumors, innuendos, and stuff that come out about the VA. For those who don't know me, and if you don't, I'm glad to introduce myself. I'm the 12th Secretary of the VA in the cabinet with Donald Trump. He asked me to come take care of the veterans. I was in Congress for over 8 years. I was ended up as the ranking member on House Judiciary Committee. I have great working relationships, not only with your Congresswoman, but with many on the Hill to make sure that we get on both the House and the Senate the stuff we need to make sure our veterans are taken care of. I'm also a 23, going on 24-year veteran of the United States Air Force. I was in Iraq back in 08-09, even had a little bit of time in the Navy. So this is something that's very personal to me. It's very special to get to take care of our veterans across the country, and especially those for our healthcare system, our benefits side, and also with our cemeteries as well. So it's a good time. Let me just touch on a few things that the Congressman Malliotakis actually talked about. One, let me just put to bed. I'm going to put an even bigger stamp on this right now. There's some studies that were done a few years ago concerning, a realignment or maybe even closures of hospitals. That is over. The Senate, frankly, a couple of years ago killed that. And the VA by itself doesn't have the authority to arbitrarily close facilities. And so I just want to get that one off the table very quickly. Because I don't want anybody fearful. And one of the things that we've been working on is right-sizing our department, and the Congresswoman actually talked about, the increase in our budget, which is very helpful. But also over the last little bit, I'm also very much aware that for 10 years, the VA also has been under a GAO audit, in other words, saying that we weren't doing what we needed to do. And I think many of you, unfortunately, may have experienced some of that. We're working every day to get better. And that means that we have to do things that work. And over the past few years, we put a lot of money and a lot of people. But frankly, just on some of the things that you just heard already on this call, we're not hitting the mark where we need to. But in the last few months, we've changed that. When I first took office, we had 260,000 in the disability backlog. We're now under 190,000, headed toward 180,000. We've dropped that. We're coming up on 100,000 in less than 4 months. That's what focus work. That means that your disability claims are getting processed quicker, you're getting answers, and you're able to move forward instead of us waiting months and sometimes, unfortunately, years to get things processed. We're able to do that a lot quicker for you. We're also able to take into our hospitals now, putting the focus and the care on our veterans and not the organization itself. I'm a firm believer that the VA is a service organization. It's not any other kind of organization, not a jobs program. It's not anything else. We got great employees. I have some of the best employees around, but we've also got to give them the tools and the function to do what they need to do, and that's to take care of you on this call and take care of our veterans as we move forward. So we're looking forward to making those changes to align our values of taking care of veterans with the actual resources we have. One last thing I just do want to talk about, and we're coming to there's been some discussion. We're firing 80,000 people. I can assure you right now that's not happening. We're looking at the ways to get more equipment, such as the Congresswoman talked about, MRI machines, all these kind of things across country, so that we can give the best hope. But also we're making it easier for you to get the care that you need, not only at the VA medical centers or clinics themselves, but also in the community. And we've allowed our doctors now, we put the forefront on best medical interest, which allows you as the veteran to work with your doctor, your primary care doctor, to get the care in the community where you choose to. And I will say this, VA care is VA care no matter where we're paying the bill. So we want it best for you. And a lot of people, would prefer to get everything through their VA, and we're happy about that. But we're also wanting to know, because the law, it says, the Mission Act says that we have a responsibility to allow for community care, to get the care that is best needed for our veterans. We're going to continue to do that. But enough of me. We got a lot of other conversation we can have, I'm sure, through these questions. But Congresswoman Malliotakis, I appreciate your willingness to do this. We're almost at our birthday tomorrow, July the 4th. What a great way to celebrate with veterans, and a great way to look forward in our country in a time that we have right now.
Thank you, Mr. Secretary. Really appreciate it. Again, everyone that is on the call, if you do have a question, please press *3 to be able to get your question through. Additionally, the Congresswoman has a weekly newsletter for constituents and veterans, providing updates on what she's doing in D.C., services available to you. And to be able to sign up for that, you can press 1 now or at any time during the call to automatically be subscribed to the newsletter. Now we will get to the questions. And right off the bat, I see one from Andrew, and you mentioned mailing in forms under the PACT Act, but haven't heard anything yet.
Yeah, Andrew, anyone who has applied for a program like the PACT Act, for example, and you've filled out the forms and you have not completed it, please feel free to reach out to my office, and we will follow up to see what happened, that there's a delay. Sometimes these programs take a little while to review, so I'm not really sure when you submitted it. But what I do want to say is my office is here to help, and we can help expedite your claims or your enrollment. And Staten Island, my phone number in the office is 718-568-2870. Brooklyn, 718-306-5600. 718-306-1620. I'll repeat those. Staten Island, 718-568-2870. Brooklyn, 718-306-1620. After the call, you can call my office. We have our constituent liaisons available to help answer your questions regarding where your claim is, and we will look into that for you.
Yeah,
Very good.
Can I
Thank you,
emphasize also
Congresswoman.
this, Congresswoman? I just
Sure.
want to say, get those stuff in, get your forms in. Again, sometimes one of the things I'm trying to do, along with the Congresswoman's help and others, is we're trying to simplify getting in. It's been too hard, in my opinion, to get people into our system, and you've earned the benefit. This is not a gift. This is not a, hey, we're just going to be nice and give stuff to veterans. You've earned the benefit. And so what we're working on in the VA right now is making it a system which is much more user-friendly to come into. We're trying to cut down the amount of paperwork, the amount of things that you have, stuff. Just to use an example, some of you probably experienced going through your disability benefits forms the first time. You had to have a whole page where you talked about your military history. I don't need your military history. I don't need you to give that to me. All I need is your name, your social security number, your DD-214. I can get anything I need there. So we're working hard to make this easier for you to get into the system, so you don't have to call a wonderful Congresswoman's office like this. But if you're having issues, please call her office. We'll be working with them to make sure that you get this done and make sure that the forms are figured out. And also out there, this would be a great thing for you as well. If you're experiencing something, and we got a lot of great veterans out there who do great work. If you see something that could be done better, let your Congresswoman know. She'll get the information to me, and we'll try to implement those great ideas as well.
Thank you, Mr. Secretary. Really appreciate it. We have another question here. Vito from Staten Island. Why is it so hard to get appointments at VA hospitals?
Well, thank you, Vito, for that question, because this is something that I've heard that there's been some issues navigating the phone system. The Brooklyn director, who oversees Staten Island, Manhattan, all the facilities in New York, he said he's working on improving some of the navigation issues to ensure that you guys have easier access to reach somebody, to schedule an appointment, and to reach your doctor. That's number one. Number two, I would really, and maybe it's something that the Secretary could help us with, I've tried under the previous administration, but it would be nice if we can get specialist doctors to visit the Staten Island clinic every now and then. For example, maybe, one day a month, or 2 days a month, you can have cardiologist visit or urologist visit. So that way they have more access to specialized care at the Staten Island clinic, not having to travel to Brooklyn or Manhattan to see a specialist. I think that's something I'd really like to work with you on, Mr. Secretary. And also, if there's any improvements that you see that need to be made with the phone systems, I know this is a nationwide problem, and we have the same problem with Social Security, and the new Social Security Commissioner is also working on streamlining the phones, because if you can't access your benefits, it's just as bad as not having benefits. And so we need to make sure that the customer service is there, that there's no long wait times, and that people are able to make their appointments in a reasonable amount of time. But anything we can do on that front, Mr. Secretary, or perhaps looking to see specialists coming to the Staten Island clinic every now and then to rotate to make it more accessible for my constituents?
Yeah, I mean, that's definitely something, Congresswoman, I think we can look at. But I do want to emphasize something here, too, is what I talked about in my opening as well, is the making sure, especially from a specialist standpoint, we are, and I do need to emphasize this, we're the largest healthcare provider in the country and from most every application that you look at. But one of the things I want to say is, and I've said this in my confirmation hearings, I've said this all along to the Hill and also a lot of media interviews, we're special, but we're not unique. We're special in the sense that we get to take care of the greatest people in the world, that's our veterans. But we are a healthcare system. And so what we're trying to do is, for those of you who may have, spouses, or you may have family members that they get their health care from private sources or even, public sources, some of the issues we've experienced are the same as any of your hospitals and any of your doctor's offices that you go to outside the VA. There's wait times, there's other things we have to deal with. So what we're trying to do is say, okay, what do we do well? Where can we recruit our doctors, make sure that we're putting them in the right places to get the appointment and wait times down. The biggest thing is making sure that we're doing it in a way that if we can do it quicker, and that's great, then we'll get you in quicker, making sure that the phone systems, however, the logistical part is taken care of. But also, if we can't, then making sure that we get you care closer to your home possibly, or closer to, to where you need it, so that we can make sure that your health, because that's the first and foremost, is health for you is our first and foremost priority, and making sure that we get that. So we're going to work any way we can. Let me just say also, there's been one of the things that slowed up that I discovered when I got here. We were doing a lot of, and I don't mean this to be bad, everybody's going to do what they need, but there was an emphasis in the VA that we had to keep everything internal to the VA. In other words, we wasn't wanting to use alternative methods, wasn't wanting to move doctors around, we wasn't wanting to send you out to the community, which the law allowed for, because there was this understanding that if we keep our numbers or our census is up, then we get our money. I operate differently. We're going to take care of healthcare. You're going to have your hospitals. You're going to have your clinics in the VA system. But I want your focus to be on quality and efficiency for our veterans. And so this is, some of the issues that we've had. I want you to know that we're working to break down any barriers, because when you try to keep everything in the VA, even if you didn't have the slots of the primary care physicians or whatever to make that happen, then that meant that we were longer times, and we were putting people, actually, there was some discussion, and we found some documents where they were actually overbooking to try and keep people from taking advantage of alternatives. So through the Congresswoman's great work and efforts, these are things that are now being exposed. She has been a leader, in making sure that we're trying to get any care that we can in the best way possible. So keep it up. We're making some progress, but we're also opening all options that we can for the veterans themselves.
And Mr. Secretary, I just want to say, in the course of the last few minutes, we've received a few folks in the queue saying that they've had difficulty getting through on the phone system, that the phones have been very difficult. So if that's something you can evaluate and have your team look at as to why there's such a complication there, that the veterans are having a difficulty getting through to make appointments.
Yeah, that we'll call in we'll make a call on that this morning, and we'll just see what that has. We'll just go straight to the source, and we'll figure this out. And one of the things, though, too, and Congressman, I think I need to mention this, and this is I don't make excuses. I say, how do we make solutions? One of the things I'm having to overcome is, and all of you know this, your facilities are 60. Most of them are very old. Most of our facilities in our VA system are 60. The average age of our hospitals is 60-plus years old. And it's hard to replace those. It's hard to because of cost aspects and other things. So we're doing in things like phone systems. We're trying to upgrade. I'm putting a special emphasis on what we call minor construction projects and other spending on those kind of issues that will allow us to update and do what we need to do to get things like that fixed.
Thank you very much. We have Irit Lev is from Staten Island is asking why the town hall is on the phone and not in person. First of all, I'm in Washington today. I'm in Washington every week this month, actually. And so we just wanted to be able, this was when the Secretary was available. He's also based in Washington, so it would be a lot more difficult to have the Secretary come to the district to do this, and we wanted to do this as soon as possible because we had been receiving a lot of inquiries from veterans that were concerned about some of the misinformation that was out there, particularly ensuring that that we were fully funding the health care and the programs, and that we actually just passed legislation from the House to increase the funding for next fiscal year. Today we're voting on the big, beautiful bill, and that's why I'm in Washington. And obviously that will have a big impact as well, a positive impact, because it is the largest middle class and working American tax cut. Also for senior citizens, seniors, 88% will see a deduction that will completely eliminate their tax liability on Social Security. So many of our elderly veterans will benefit from that. And also, if you are a homeowner predominantly, but anybody in New York, you will get a $40,000 SALT deduction restored, which will be significant savings. And anyone who has anybody who's on Medicaid, I want to make clear that we protect our seniors, our most vulnerable, our children, those with disabilities, and pregnant women, anybody below the federal poverty line that currently qualifies. for Medicaid, the traditional program, the most vulnerable, they are protected. And we simply ask for individuals who are able to work of working age to do so part-time. And so I just wanted to cover those two things since it was brought up as to why I was here in Washington and not in the district.
Great. Thank you, Congresswoman.
Can I emphasize something on that as well? And it goes into not only the funding part, which Congresswoman, you've talked about before. Some of the lies that have been out there is that we're cutting benefits and we're cutting the health care. That's just a lie. And I don't care who says it in New York. I don't care who says it across the country. If anybody, elected official in Washington, D.C., tells you that we're cutting benefits or health care to our veterans, I'm from North Georgia. We just call it like it is. It's a lie. And it's not political spin. It's not being a political party. It's just a flat-out lie. And if anybody ever tells you that, then you say, show me. And they're going to have to start stammering around because they'll be called on that lie. I do not want anybody scaring my veterans. I don't want anybody scaring my VA employees. We're going to do the work that we need to with great help with folks like Congressman Malliotakis and others to make sure that you have what you have earned and is according to the law. So just know that the things that we got going, including the big, beautiful bill, I mean, when you help the country, you help veterans. And I'm looking forward to y'all up there finishing that up and know the benefits that's going to come from it.
Yeah, and actually I should mention two other major components of the bill that we're voting on today is actually national defense, investing in our military significantly, and also border security. So those are two major pieces that I know many of our veterans care about in Staten Island and Brooklyn. So I just wanted you to know that this is going to be the largest investment in our national security, and it's very significant.
Great. Thank you, Congresswoman. Again, if anyone is on the line and would like to ask a question, please press *3 now. And if you'd like to sign up for our newsletter, please press 1 at any time during the call. We'll move on to the next caller. All right. We have Richard from Bay Ridge. Given your efforts to prevent closures of medical centers in the district, where are those at and are they closing?
Yeah, as I mentioned, Richard, at the beginning of the call, we successfully stopped the previous administration's proposed closure of the Brooklyn facility. Some of our veterans in the community actually joined me for rallies and press conferences, so I really thank you all who did turn out when we were making that push because it was a group effort. Mr. Secretary, it would be great if you can reassure our veterans on this question. I know that you and I had spoken when you came to speak with a group of my colleagues and I, and you did mention that there are no plans to have any closures of VA hospitals.
Yeah, no, there's not. And I think that's something that was put to rest actually a couple of years ago. It just still floats around, is going on, but we don't have any. I don't have any legally weight for me to just say, no matter where it is in the country, that a facility is going to close. So that's just not happening. And the biggest thing is just folks, just get out there and use your facilities. I think one of the other things is we have a lot of folks, and I need your help here, and it's a good time to transition to this. For veterans on this call, how many veterans do you know that are not taking advantage of the benefit earned? How many of you veterans out there have buddies that you may drink coffee with, or you see, or you go to, or you see them at the VFW, you see them at the American Legion, you may see them, but they don't use their VA benefits. They don't use their health care. They don't take care of the preventive medicine that can help them live long and healthy lives. That's one of the issues that I'm going to be focusing on, is making sure our veterans are living healthy lives, just as they did when they were in the military. But also, are you keeping up with the veterans in your community that need help, who may be going through crisis, who may be struggling? Suicide among veterans is way too prevalent. We lose 17 to 20 veterans a day, not a week, not a month. We lose them a day. And my goal is to make sure that the VA is getting them to the areas that they need, sometimes just to talk. Go to your vet centers, go to your places, and just get them somewhere. I don't care where they go, but we as veterans, we owe it to our fellow brothers and sisters in the services to not lose contact, to not lose our battle buddies, to not lose our wingmen when we go forward in our life. So that is why our clinics are so important. That's why our hospitals are so important. That's why our benefit side, our vet centers are so important to me, to make sure that we're getting people the help that they need. So we're not closing, we're continuing on. So I need your help, though, in just using those and making sure that those who are not using it understand that they have the benefit option of being part of the VA family.
Thank you, Mr. Secretary. I also have a question directed for you, Mr. Secretary. A representative from American Legion, Lester, has been trying to get a veteran cemetery on Staten Island. What are the chances of something like that happening, and do you know what the process is for that?
I do. It's a long process. It's long in the sense that we got to go through making sure that we can find land, which is a premium on Staten Island to do this. We do have an urban cemetery initiative that I'll be happy to talk to our cemetery folks about and see if that's even a possibility. We can do those on much smaller plots of land with columbariums and stuff. So it's a possibility. I appreciate you bringing this up. Appreciate my friends at the American Legion. Let's see what we can do. I'll be happy, Congresswoman, if you want to help follow up on this as well. Just I'll make sure our folks are already on it. But you just can work with my team, and we'll get an answer. I can't promise it by any stretch of the imagination, but I'm more than happy to look and to see what the possibilities are, okay?
And, Mr. Secretary, is that usually land that would come from the city or the state? Like how do we go about trying to find a plot of land that could be transferred?
It varies. I mean, it's done across the country in very different ways. The best thing for us to do is probably have, and I think your staff knows my Joel Katz very well. We'll just have a discussion, and I'll make the initial conversation with our NCA folks. But Joel will come by and let's talk to you about your folks, and we can sort of lay out if there was a possibility of doing this, what the steps would be and how we'd go about that.
Thank you very much.
Great. And we have a poll question for those that are on the call. Do you feel that your VA care has been adequate? If yes, press 1. If no, please press 2. All right, and we will move on to our next question. All right. We have Gary from Bay Ridge refused getting ID cards to go to the VA hospital, even though you're a veteran. And this is the president of Rolling Thunder, Chapter 1.
Gary, I think if you want to call our Staten Island office after, we'll be happy to try to figure out what happened there. Our number is 718-568-2870. If you give us a call, we'll look into why you were denied an ID card. And there's another question here from James Brown of Staten Island. And could we do away with the categories to classify veterans on a scale from 1 to 8 for medical benefits? Mr. Secretary, do you know?
I'm not exactly sure what they're. I'm sure it's just being worded in a way that I'm not, just hadn't heard. So, but just tell him, please. I tell you what, do this. Take down his information. We'll make sure we get him a response on what that exactly is and what he's asking about. And especially that ID card.
Very good. We'll do that.
Yeah. Okay.
Sounds great. And then we have Jean from Staten Island who asked. They'd like to know more about the people at the VA that are being laid off.
Yeah, Gene is the president of our Vietnam Veterans Chapter, and he's asking about layoffs. And I'll go back to what I said earlier in the call, and then if the Secretary could maybe add to that. There have not been the Veterans Affairs medical staff have been exempted from the across-the-board government hiring freeze, and essential jobs like doctors, nurses, and claims processors have not been cut. The Trump administration and the Secretary determined to improve the operational efficiency of the VA, which includes phasing out non-essential roles like interior designers, DEI positions, and other non-essential administrative positions. And by phasing out those non-essential jobs, they will be able to redirect resources and staffing for care in particular. I also want to mention that when we spoke with the director, Timothy Graham, regarding a particular unit that was on at the Brooklyn VA, the reason that had been temporarily closed was because the staff members left. There was a nurse and a psychiatrist, and I believe a social worker that had left on their own accord. They had other jobs or they retired, and they're currently looking at replacing those and expect it to be up and running very soon. So that could be one of the issues that you may have heard about. But Mr. Secretary, if you'd like to talk a little bit about what you're doing in terms of staffing and how it relates to nurses and doctors and people who might answer the phone and help schedule appointments.
Yeah, no, that's not a problem at all. Look, the easiest way to have this, we've presented over 350,000 positions that are not in any way touched by any hiring freeze or anything else that we've been going on, even as we were looking at, what was widely reported as a reduction in force. And it's been said that, we're going to fire 83,000 people. I said earlier in this call, that's not happening. But also, as we look at this, we have had some issues where we've had people take an early retirement. They decided to leave. But I will tell you this, they were also bound by the 350,000 plus positions. So, if they were actually taking care of patients, they're actually doing the benefits, they're cleaning rooms, they're doing sterilization, those are not able to access that. Now, I do want to say this. We are like, and I appreciate the Congresswoman bringing this up, we're also a hospital system. We do have people who leave. We do have doctors and nurses and others who choose to take other jobs or retire or just get out of to leave altogether. The same as you would have at any of your hospitals that are in your community that do not have a VA on the side. We're in the same boat. We're working to recruit doctors. Right now, there's not a doctoral position that is not exempt. We're hiring them tomorrow. If you got nurses, LPNs, CNAs, anybody wants a job, tell them to come apply for a job. Guarantee they'll pretty much be hired. Again, this is the discussion that we're having as we look at areas of consolidation, areas that we have that are taking money away from veterans, and this is where you need to understand, that was taking money away from veterans in areas that we could do better. We found out that we were having, we're supposed to have centralized our payroll system just a few years ago, but the VA, for some unknown reason, decided that we allowed 60 of our hospitals just to continue to do their own payroll. That was almost, that's several hundred up to 1,000 employees across the country that were duplicative roles that we were doing and should have been doing in the central office, we were doing and still allowing them to do in hospitals. That's just something that's taking efficiency away from our veterans, taking monies away that could be spent for, adding doctors, adding nurses and others into duplicative roles. We see the same thing in our human resources. We've seen the same thing in our contracting. So there's a lot of things that never touch a patient, never touch in the sense of having direct care, that do not impact our care and benefit side, that we have, that we've been looking at to say, how do we do this efficiently? Because every veteran on this call is a taxpayer. You also should be very concerned about how we're spending your money. But the last part is for all of this out here, there has been no layoffs. I can't emphasize this enough, and I spend most of my time talking about this. If somebody has left the VA, they have chose to do that on their own. We did have a time in which there were some probationary employees early on that were let go, but in very fairness, the court put them back. Again, that's the difference of opinion we have, but they came back. So for anybody to tell you that layoffs, hiring freezes, especially in our hospitals, are affecting care, is just frankly, that's their own political spin. That's just not what is happening. We have areas that we need to hire. We're going to hire to make sure our veterans get the care that they need.
Well, thank you. Thank you, very much, Mr. Secretary. I'm happy to stay on the call to answer a couple of unrelated questions regarding today's bill. But, Mr. Secretary, I want to thank you for joining us today. You've been very gracious with your time. We appreciate the explanations. And again, our office is available if people want to ask additional questions or they need assistance. Please feel free to reach out to us. So, Mr. Secretary, we're okay with you signing off now, and I'll just stay on a little bit to just talk about today's big, beautiful bill.
That's exactly right. Well, great. Congresswoman, you have been wonderful. I appreciate all the work that you're doing for the fine folks up there. You continue to know that you have a partner here at the VA to do what we need to do to take care of our veterans. I look forward to getting up and being at the Brooklyn Medical Center later, probably this year, probably over at Staten Island as well at the clinic. But we're looking forward to being back up to do that. And anything in the meantime, please let our office know. Veterans, get out there and find your folks. Make sure that they know what's going on, and don't believe all the stuff that is being said, because you've had a chance now to hear exactly from me where we're heading, what we're doing. You're going to hear even more in the coming weeks and months ahead. So thank you, Congresswoman. I look forward to continue to work with you.
Great. Thank you very much. So Mimi from Staten Island did have a question regarding our work with the big, beautiful bill. And I'll just give a brief overview of the bill. Provides the largest middle-class tax cuts in history. It also makes sure that we're rooting out waste, fraud, and abuse in Medicaid while preserving the program for our most vulnerable. Someone else also asked about the work requirements. So when we talk about this, I want people to understand that seniors, disabled, children with developmental disabilities, actually all children, pregnant women, those who are low income under the federal poverty level, these are traditional Medicaid recipients. These individuals are protected, and they should not worry at all. What we do is try to root out waste, fraud, and abuse by ensuring that the benefits do not reach people who are in the country illegally, that ineligible fraudsters are removed from the rolls, and if you are able-bodied of working age, and you don't have dependents that are under the age of 14, we have a reasonable work requirement, which is 20 hours a week of working, volunteering, or learning. And that's vastly supported, these provisions, by majority of Americans. There's been a lot of fear-mongering. There's been a lot of misinformation. So I wanted to clarify that because that was one of the questions that we received. Now, in terms of the military, there's many provisions in there that are protecting our military. Our Coast Guard on Staten Island will certainly benefit as well. We're going to have an investment made in something similar to the Iron Dome that Israel has. But shipbuilding, very important for our naval fleet. These are military investments that need to be made because we have fallen way behind communist China. The president is committed to increasing our investment in defense, as he has successfully urged when he recently went to NATO, countries in Europe and part of NATO to increase their investment in defense from 2% to 5%. So that's significant. We saw, with Iran, why this is important. We have to make sure that we are a modernized, well-equipped military with the best equipment possible for the men and women who are serving. Border security measures in the bill. It's the largest investment in border security, and it would add border wall, river barriers, other barriers. It invests in hiring 10,000 ICE agents, and it gives Tom Homan and Secretary Noem the resources that they need to deport the criminals, the gang members, the drug traffickers that we know have been wreaking havoc in our city. So that's a major component to this as well. Now, on the tax cut piece, I want you to know that we worked very diligently. And actually, the tax portion came out of my committee. I'm a member of the House Ways and Means Committee. And so I worked very hard on this particular piece and worked very diligently to ensure that it's focused on middle class, working Americans, and senior citizens. The senior citizen component is actually my legislation that's in this final package. And what it does is it provides a deduction of $6,000 per senior, and for 88% of our seniors, that means that deduction would erase your tax liability on Social Security. Now, people ask, why did you not eliminate the tax on Social Security altogether? The answer to that is because you cannot do it in a reconciliation package like this, where we're passing it, where you only need 50 votes 51 votes in the Senate. To change Social Security law, you would need to get 60 votes, which means 7 Democrats would have to join us. And right now we don't have that support to change the Social Security law to make more Social Security tax exempt or to eliminate the tax altogether. So what we did instead was provide this deduction that will benefit 51 million seniors. Most in our district, quite frankly, will benefit from this. And then if you're not covered for some reason, you might have a higher income. I mean, the income for this is $75,000 for an individual or $150,000 if you're married, and you would receive $6,000 deduction for single, $12,000 for married, and the deduction decreases as your salary increases from there. But really, everyone who's earning an income of less than $175,000 or $350,000 if married will receive this senior deduction. So it does cover the majority of seniors in my district. But let's say you do have an income over that, higher than that. You will still benefit from the SALT deduction that we were able to restore. The SALT deduction will now be $40,000. That is really that covers 98% of our district. I don't believe anybody, I don't want to say that for sure, but I don't believe anybody in the call probably has a SALT deduction of as high as $40,000. I think that really does cover everyone based on the analysis that I've seen and what people previously deducted in 2016. So what I would say is that is a big deal, particularly for our homeowners, because we know our property taxes, the city hall keeps increasing that levy each and every year, something that we're very angry about, and I'm trying to provide some relief from the federal level. And so there's other provisions in there. Obviously, there's some relief for tipped workers, for those who work overtime. And I think the other thing to point out is the standard deduction, the child tax credits, would have been cut in half if this bill did not pass. Income tax rates across the board would have increased. So the child tax credit now instead is increasing. So if you have grandchildren or children, you'll receive $2,200 tax credit for each child. And the standard deduction, which some people claim, instead of SALT, because they don't have that much to deduct, that is increasing as well. It will be double what it was in before 2017, and we increased it a little more for inflation. So, these are, I think, really important measures, and I think it's really great that we're focusing on providing relief for working Americans and middle class. Middle class oftentimes gets forgotten by government. It's nice to know that government is focusing for once on hardworking Americans who, in this economy over the last few years, were struggling to get by.
Great, thank you, Congresswoman. And as an additional follow-up, one more time, if you would like to join the Congresswoman's newsletter, please press 1 now, and you will be automatically subscribed. And we would like to thank everyone for joining us this morning. We were able to reach many of you, but if we were not able to take your question, or if you need any assistance with Veterans Affairs or any federal agency, please reach out to Congresswoman Malliotakis' office. You can visit our website, malliotakis.house.gov. That's malliotakis.house.gov. Or you can call one of our offices, our Staten Island office at 718-568-2870, or our Brooklyn office, 718-306-1620. Congresswoman Malliotakis, would you like to leave?
And again, just to leave off, thank you all for joining. I appreciate those of you who stayed for the entire call. I hope you found this beneficial. I thought it was really important that you hear directly from me and the Secretary about some of these things, about closures and units shutting down and staffing levels. Obviously, as we addressed during the call, a lot of misinformation has been out there. Our office is always happy to help. We will continue to do our monthly newsletter, and I want to wish everyone a happy Independence Day, and thank you for making sure that we are a free nation for nearly 250 years, 249 years, and it's because of the men and women like you who have served. Have a great day, everyone.